am an otolaryngologist, an ENT surgeon, but I subspecialize in otology, neurotology, and skull-base surgery. It's a big word, but it basically means I just treat the ears and disorders related to the ears. I treat adults and I treat children, anyone with ears, and I treat disorders of the ear that require surgery and things that just need medicine or an office visit. So I treat the complicated disorders of the ear, and the usual thing that I see is anything from a child with bad ear infections that just don't get better after antibiotics, or someone with hearing loss, even as bad as deafness, that can be treated with a cochlear implant or with other things sometimes. So anything where the brain space meets the ear space or anything involving just the ear. Some of the things I treat don't need surgery. There are people who have tinnitus or dizziness, and sometimes some vestibular rehabilitation or medications to manage the tinnitus can be helpful. In addition, we have a full-service hearing aid department for people who have hearing loss. My philosophy about the treatment of ear disorders is to be as conservative as possible. I want to get to know you, and I want to get to know your ear problem, and then use the least invasive, least treatment that I can use in order to get you better. And sometimes that's as simple as an in-office procedure, and sometimes that does require going on to having a surgery on the ear. Many of the patients that I treat come in with a problem, and we fix the problem, and they go home happy and may never need to come back and see me again, and that's wonderful. But there are other problems with the ear, like recurrent dizziness or recurrent ear infections, where someone may need to see me every few months for an extended period of time. There seems to be a great need for otologists, and if someone keeps looking until they find that one right person who can help them and help them fix their problem with the ear, I'd be happy to be part of that. There are not too many of us around the world.